I'm a fourth-year otolaryngology resident and the chair of the Johns Hopkins House Staff Council. We have partnered with our co-sponsors across the medical campus and across the city of Baltimore to bring you tonight's event. I would especially like to thank Karen Haller, the Vice President for Nursing and Patient Care Services, who had the idea to bring everyone together tonight, and the Office of Medical Affairs, the Office of Johns Hopkins Physicians, and the Vice President for Nursing for graciously providing funding for our reception afterwards. Tonight represents a special opportunity to come together as a community about a topic that is important to all of us. Represented in this room are the current leaders of Johns Hopkins, including our very own Dean Rothman of the School of Medicine, as well as many of the nurses and physicians who care for our patients on the ground every day. We are joined by health policy faculty from the School of Public Health, and maybe most importantly, by tomorrow's leaders, the students from the School of Nursing, Medicine, and Public Health, the residents and fellows from the hospital, and students from Notre Dame of Maryland University School of Pharmacy. I sincerely welcome all of you this evening. Two distinguished individuals from nursing and medicine have agreed to be our moderators for the event tonight. Cinda Rushton is the inaugural Anne and George L. Bunting Professor of Clinical Ethics. She is a professor of nursing with a joint appointment in the School of Medicine's Department of Pediatrics. Dr. Rushton is a founding member of the Johns Hopkins Berman Institute of Bioethics and a co-chair of the Johns Hopkins Hospital Ethics Consultation Service since 1999. She is an international leader in nursing and clinical ethics, and we are very fortunate to have her with us tonight. William Baumgartner is the Vincent L. Gott Professor of Cardiac Surgery and Director of the Surgical Research Laboratory. He joined the Cardiac Surgery Division in 1982 and led the division as Surgeon in Charge and Residency Program Director for 17 years. Today, Dr. Baumgartner serves as the Vice Dean for Clinical Affairs, the President of the Clinical Practice Association, and the Senior Vice President of the Office of Johns Hopkins Physicians. We're thrilled to have him with us this evening. Please join me with a round of applause in thanking our moderators for sharing their time with us. And now I'd like to welcome Dr. Baumgartner, who's going to introduce our film.
Thank you very much, Susan, for that very nice introduction. And I would also like to thank you because Susan was the one who really spearheaded this entire event tonight. From soup to nuts, we've helped in many small ways, but she's the one and her House Staff Council who really deserve a round of applause. So I'd like to welcome all of you on behalf of Cinda and myself to this event, and particularly welcome Dean Rothman. This is a movie that I think you will all enjoy. It's provocative. It really talks about the crisis in healthcare, but to me, it also gives many opportunities to be able to walk out of here tonight and help in the transformation that's occurring in healthcare, not only at Johns Hopkins, but across the country. You might wonder about the title, Escape Fire. From the dictionary, it includes two definitions. One, a swath of grassland or forest intentionally ignited in order to provide shelter from an oncoming blaze, and you'll see in the movie how that transcribes. But the other definition is an improvised, effective solution to a crisis that cannot be solved using traditional approaches. And I think healthcare healthcare is in such a crisis that the current modus operandi is not going to be successful. And I think you'll hear that. This came, and you'll see, from Don Berwick, who was the director of CMS for a period of time in the recent past. And one of his talks, his talk was described, Escape Fire, Lessons for the Future of Healthcare. So I hope you'll all enjoy it. Afterwards, Cinda and Susan and I will lead a discussion. We also want to assure you that we'll be done by 7:30. So I know everyone has other home life to go to. So why don't we run the movie? Thank you.
In this film tonight, Escape Fire. So one of our goals for this evening is to stimulate some dialogue. And so in the spirit of that, I'd like to invite you just to take a moment to reflect on what really stood out for you in the film. And to share that with someone next to you. To, if you don't know who's next to you, introduce yourself. And see where you have some commonalities or differences about what stood out. So I'm sure we could probably talk for hours about this film, but we would like to hear from you a little bit. And this is a very high-tech room. And I've been told that these microphones in front of you, if you push down the button and the red light comes on, you'll be able to speak so that everyone will hear you. So I'd like to just hear from you what stood out. What stood out for you in this film? Speak into the mic.
Hello. I guess what stood out to me, or
You gotta keep it held down.
Yeah, hold it down. There you go.
okay, thank you. What stood out to me was so many people saying what we could do as a whole. It's the sum of all the parts. It takes a village. Hopkins is such an international force to be reckoned with. What can we do? What can we do? How can we help? Do you start with all of your employees, your staff, your faculty? Look around at some of the people we work with. You know, maybe some of us don't handle stress well. Maybe some of us have physical chronic diseases. Maybe some of us have some emotional type. And when you listen to what the CEO of Safeway said, and then you look and see so much that can be available here. And the first step's the hardest, but then the next step is easier. So how does Hopkins start with its own little village and community, and then work out to internationally what they can do for the world, for, like Dr. Weil said about preventative care. When I was in nursing school a long time ago, a lot of it was focused on primary care. That's how we learned. Now, again, the focus is indeed on more the specialists, more the secondary care. It's not how to keep people healthy, but it's more to figure out what went wrong and then how do they live with these chronic type diseases or heart attacks, you know, all different things of that nature. So I guess my big question is, how do we figure out how to move forward, and how can we can make such an impact, both in our own community, just our own Hopkins family, and then worldwide?
So, it's a great question. And part of this conversation is to begin to design the solutions together. And they're going to take individual changes in how we ourselves approach health, how we approach our patients. Are we going to move from rhetoric to action, where we actually take care of patients and families and our colleagues in the way that we want to be treated. That would begin to shift the way we think together, for one thing. How do we begin to ask the question of why and why not? So if you want to begin to shift autopilot and dismantle the autopilot responses of how we treat patients with treatments and interventions and surgeries, we need to stop and pause and ask, how does this actually serve this patient's goals? How do we begin to use things like choosing wisely, a program that is designed to cut out of our repertoire the things that actually don't work or may actually cause harm. So I think that we're in a process where we're beginning to design, and we're going to need all of us to be a part of that. We're going to need to have some more conversations. And I think Dr. Baumgartner and perhaps Steve Rothman might want to say something about that.
So that's a great question. So two things I think we're starting to do. One, which, in the strategic plan, the number one thing for people with Hopkins, and we're going to begin something called Healthy at Hopkins here, to work on our own community in terms of preventative care for our own employees here. That has to do with getting healthier food on campus. We're going to do away with the sugary drinks on campus, especially big drinks, And the mayor couldn't do it in New York, but we probably could do it at Hopkins. So we're actually going to, in our own community, start to develop a Healthy at Hopkins initiative for the employees within this campus, and then eventually the university is going to do that not only in East Baltimore. So I think we're going to begin that. And I actually went to visit Steve Bird at Safeway about last summer to hear about what he's done, and we're going to take some of the things that he's done there and do it here. I think as importantly, and you bring up this point, what we're going to do for, I would say, the community in Baltimore. And so for those of you who don't know, Patty Brown's running this huge J-chip plan, which is starting preventative care and population health in East Baltimore, the 7 zip codes around this hospital. And that's a $20 million grant that we're in year 2 of. And we're trying to figure out how we're going to sustain that and try to do population health in Baltimore. Because for those who don't know, the new Maryland waiver will require the whole state of Maryland to start getting reimbursed on a population health mechanism within 5 years. So what Berwick and those guys are talking about is going to happen here in Maryland in the next 5 years. The problem is we don't know exactly how to do it yet. And so we're going to need everyone here to start to work on that. But this is happening. It's going to be very quick, and it's going to happen here in Maryland. Bill, do you want to add on that?
Thanks, Cinda. You might wonder why a cardiac surgeon is moderating this study. Not to mention that I'm a hillbilly from Kentucky. But I feel very passionate about transforming healthcare. And I want to pick up on, I think you raised a very important question. And that is, what can I, as an individual within Hopkins, do to help transform healthcare? And I think it's not going to happen overnight. It's a very complicated system, right? You saw it. But each one of us can do something. So there are a couple of ways that I think you can do something. Cinda commented on choosing wisely. Show me a show of hands of anybody what knows what choosing wisely is. It's good, actually, a fair number. Okay, so choosing wisely is a campaign that started by the American Board of Internal Medicine. And they asked societies to come up with 5 tests or 5 imaging studies in which they are either unnecessary for the particular diagnosis or they're overused. There are 50 societies that have now come up with these 5 areas. So whatever you're interested in, whatever your field is in, you can relate to those 5. Now, they're not just for the doctors. We have to educate our patients because educating the patients, then they don't necessarily demand back pain, which those of us who treat patients, we see that happen. So it's not just the doctors choosing wisely campaign. So I encourage you to look it up, look what pertains to you, and I think you can practice that actually tomorrow. And the other thing that Don Berwick ended with is patient-centered care. And we talk a lot about that. That is a lot of verbiage around the country about patient-centered care. It is, to Dr. Rothman's point, another one of the 6 strategic pillars to become a patient-centered care healthcare system, not just Hopkins, but our whole healthcare system. There's a lot of components to that. It means a lot to different people. But to me, it's pretty easy. And you can practice this tomorrow when you walk into a patient's room or greet a co-employee in the hallway. And that is, how would you, or how would your mother, or how would your father like to be treated at this institution? So this is something, it's like the old golden rule. It's been talked about. It is absolutely true. So I think those of us who care for patients, in whatever way we do it, whether it's direct care, whether it's administration, whether it's any way that we have an influence on patients, by going and being compassionate, empathetic to those patients is huge. That alone, I believe, can help change and transform what we're doing. So there's a couple areas to think about when you walk out of here tonight. We're in a great time, actually, for healthcare. I mean, that's all bad news. All bad news. But it's a huge opportunity for us to change the way in which we deliver healthcare. And as Dr. Rothman said, we are doing that in small ways. It isn't going to be a big boom and overnight it's changed. We haven't been awarded it yet, but we're soon to be awarded. We feel pretty confident of an accountable care organization where we will be in charge of about 35,000 patients. Now that's a small subset of patients, but again, looking after all of their needs. So we've got a toe, maybe we've got a half a foot in the water in different areas. But it's a really exciting time. You all are the future leaders, so we all would anticipate that you will pick up this idea and carry it forward.
So I'm a primary care physician here, and one of the things that came up, and it was very obvious in the film, was that volumes and having to see patients, we actually get 30 minutes per appointment, so I think it's a long time, but it's pretty clear that we can't do patient education or discuss what's moving, why they don't need antibiotics, and also treat their other problems during the visit with the current structure. I'm just wondering if there are thoughts about how that's going to change. Right now, I'm supposed to see 8 patients in a session, 4 hours. My patients wait an hour at least to see me as a result.
Either of you like to respond to that?
I think you are exactly saying what that young woman, primary care physician, dealt with. There's no question, and I think the last statement, I believe it was by Dr. Berwick, was until we change the payment system, until we change it, I don't have an answer for you. And I honestly don't have an answer for it. I think we can help around the edges of a particular practice so that we make use of medical assistants, we really engage a team of nurse practitioners and others, but I believe that until we actually do change the payment model, we're going to be stuck with what you said but it's changing. It's not going to change overnight. We're not going to go for a fee-for-service to population health overnight, but it is changing. It is because it makes a whole lot of sense. It's not, the idea of keeping people healthy and out of the hospital, it makes a whole lot of sense. You wonder why we're standing here talking about this. This hasn't been done 30 years ago. But again, I think it's just the way to say, everybody's doing the right things, what they grew up to do. But I think we now realize that this is unsustainable.
Gail?
The part of the movie that I found most moving was the military story. And I'm just wondering what it would take for Hopkins to integrate something like acupuncture systematically for pain management. And a sort of second part of that question, I'm involved a lot in medical education. And it is striking to me how absent nutrition is from medical education. And what would it take to make that a bigger focus in medical education?
The dean responded.
So first of all, I also found the military very moving. And Hopkins is doing a lot of amazing things trying to work with the military. I don't know if people know, but the university now has a Military and Veterans Health Institute that we've begun to try to address. So that's a huge issue that we're very committed to. It's funny, I was just saying the acupuncture stories. I have a bad back, and I had treated with narcotics, and then I got acupuncture. But my narcotics were basically $5 for my copay, but acupuncture was out of pocket that I had. So even for me, it was $50 to get an acupuncture. So that's a huge issue, and so I'm a believer actually in acupuncture, and it's an important modality among others to treat pain. I think we can do that. And in terms of nutrition, I've actually asked that I think we do a better job than we used to do nutrition, but we probably don't do as much. I actually asked our dean for education 6 months ago to try to ask what we do in nutritional education at Hopkins. So I agree it's an important thing that we're working on.
So, Dr. Baumgartner made a commitment for us to end on time, and we're already sliding a little bit past that. But it's clear that this is a topic that we need to continue the dialogue with. It is a topic that is not going to be solved, as we've heard, with the way that we've done things in the past. And it's going to require us to actually shift into new ways of thinking, new ways of designing our systems, new ways of being together. And it's not going to happen by one discipline alone. And so it's really an opportunity. Part of the goal of tonight is for an interprofessional dialogue. And that interprofessional dialogue requires all of our voices to be a part of the conversation. And so what we'd like you to do, if you would, is we've given you a card, and we'd like to begin to collect some of the solutions that you already know about how we can begin this process. What can we do now to begin to address some of these gaps in our system? And we want to collect your ideas and learn from you, because often the innovation comes from the people who are the closest to the issues, and that may be all of you. We want to invite you to be informed, to learn about the impact of these clinical and policy changes on our practice. We have an incredible program here in health policy and healthcare transformation, offering programs to help us become educated about these issues. The Bioethics Institute is hosting a program in January about accountable care organizations and some of the ethical and policy issues that raises. And also, it's an important opportunity for each and every one of us to be a voice for change. It's not about them making changes. It's about each of us committing to what are we going to do to contribute to the shift that's needed in healthcare. And that involves telling our stories, developing that 3-minute elevator speech, elevator with somebody that you need to influence, you're ready. And you can tell the stories of how the current healthcare system impacts real people, the people you take care of. So we want you to be engaged. We want you to help us to design the solutions and to be part of what we do so well here at Hopkins is to emulate and lead. So thank you all for being here. There are baskets outside the door where you can drop your card